Have you been prescribed a high-dose weekly vitamin D treatment and wondering what side effects to expect? That's exactly what we're covering today. Before we dive in, this video is educational only. We won't be covering dosing or schedules here. Always follow the instructions on your prescription and speak with your GP or pharmacist about your individual treatment plan. Do not buy or take high-dose vitamin D without medical supervision. So, what is this type of treatment? A high-dose weekly prescription vitamin D is used to treat confirmed vitamin D deficiency. It's not a routine supplement. It's significantly stronger than anything you'd pick up over the counter, which is why it's prescription only and requires proper medical supervision from start to finish. Most people tolerate this treatment well, but some do experience side effects, particularly in the early weeks. The most common ones are gastrointestinal, things like nausea, constipation, and abdominal discomfort. Headaches and muscle aches have also been reported. The good news is that these tend to be mild and often settle as your body adjusts. If they're bothering you, mention it to your doctor, but don't stop taking your prescribed treatment without speaking to them first. The more serious risk to be aware of is vitamin D toxicity, which can lead to a condition called hypercalcaemia, that's elevated calcium in the blood. This is uncommon when treatment is properly supervised, but it's important to know the warning signs. These include excessive thirst, needing to urinate more than usual, confusion, persistent vomiting, and generally feeling unwell. In more serious cases, toxicity can contribute to kidney stones, heart rhythm disturbances, and kidney impairment. If you notice any of these symptoms, contact your GP urgently or call NHS 111. If you collapse or are severely unwell, call 999. There are also certain conditions where this type of treatment may not be appropriate. If you already have high calcium levels, a history of kidney stones, sarcoidosis, or a condition called primary hyperparathyroidism, this treatment may be contraindicated. Conditions like chronic kidney disease may also require specialist assessment beforehand. This is why your prescribing doctor needs a full picture of your medical history before you start. In terms of monitoring, your doctor will typically check your vitamin D and calcium levels before you begin, and then again at intervals they advise during your course. Once your levels are back in a healthy range, you'll usually be moved onto a much lower daily maintenance dose. These steps exist to make sure the treatment is working safely for you. So, what should you discuss with your healthcare professional? Ask what monitoring is planned during your treatment. Let them know about any other medications or supplements you're taking, as these can interact. And if you develop any of the warning signs we mentioned, excessive thirst, confusion, persistent vomiting, or increased urination, don't wait for your next appointment. Contact your GP or NHS 111 promptly. To recap, this is a short-term therapeutic treatment for confirmed deficiency, not an everyday supplement. Common side effects like nausea and constipation are usually mild and temporary. And while serious toxicity is uncommon, knowing the warning signs of hypercalcaemia is really important. You can also report any side effects via the MHRA yellow card scheme. We'll link that in the description. As always, nothing in this video replaces personalized medical advice. Please speak to your GP or pharmacist about your own situation and only follow the dosing instructions on your prescription. If you found this helpful, leave a comment below and don't forget to like and subscribe for more straightforward health information from Bolt Pharmacy.